technology has markedly improved in terms of hair transplantation surgery. We're now able to achieve natural results treating almost any degree of baldness in men or women, and we're able to do it in a relative scar-free type of environment. The, again, basic concept is what's called removal of follicular units or naturally growing hair cluster groups. That gives you the most natural result and prevents the corn stalking or pluggy look that was seen previously with hair transplantation surgery. So really the state of the art in 2021 is combination treatments, usually with high dose minoxidil, PRP, low energy light sources to try to slow down hair loss or regrow some hair. And once we've stabilized the hair loss for balding areas, then we perform hair transplantation surgery. Now, the three ways that you can remove follicular units are either using hand engines. You can use what's called suction, again, removal device called the NeoGraft or SmartGraft, or you can use the robot, which is the ARTIS robot. So we used to do hair restoration surgery by taking a strip of scalp out and then dissecting under a dissecting microscope these follicular units, but it would leave a linear scar, although that sometimes is done and actually may give you a slight increased density of hair in the transplanted area. Most people use this concept of removing these follicular units. What we do is shave the donor area of the scalp where we remove the follicular units, and then either use a hand engine to remove these small little follicular units, or the suction device called the NeoGraft or SmartGraft is the other technology out there, or to use the ARTIS robot. What this has allowed us to do, again, is to remove a large number of these follicular unit grafts, any place between 1,000 and 4,000 units in a relatively short period of time, and then reimplant them from the donor area, the back of the scalp, where you rarely ever have, again, genetic hair loss, into any other area where there's balding, such as the frontal or temporal areas. So the again, NeoGraft is a suction type of device. It's a powered drill with suction that actually removes the follicular units from the scalp. And again, they go into a small canister in a holding solution. And then we use usually either a large bore no core needle or a needle device, or you can use, if you want, also a blade device to create little holes where we want to reimplant the grafts into the recipient area. Now, the robot does this in an automated fashion, the ARTIS robot. So now it's able to actually, under robotic, again, direction of the physician, remove these follicular units in a very exact fashion. It tells where the best hairs are, it removes the best hairs, and if there's no hairs or poor hairs, it doesn't remove those areas. So you get a very precise removal of the follicular units that's done by the robot. The robot is able to recognize via this pigmentation in the hair where the best hairs are and is able to remove those follicular units. With the new generation of the ARTIS robot as well, it's actually able to implant, again, the hair into the recipient area. So it's the first procedure in aesthetic medicine that's actually totally automated and using robotics. There's almost no downtime. They wear a light bandage overnight, which they remove the next day. And then the area where the hair is shaved in the back of the scalp to get the follicular units, that regrows in a couple of weeks, 10 to 14 days. So, and then you have these little micrograft sites that tend to just sort of get incorporated into the scalp. You might get a little bit of flaking for, several days or a week or two after. Then the hair begins to grow, usually within any place from 3 to 12 months after the implantation. But you can get, the only real downside really is occasionally, if you do the frontal area, you can get some swelling in the forehead for a couple of days.